Madam Chair, honourable delegates.
Is it working?
My name is Holly and I'm a physician in training, speaking to you today on behalf of the young people of the UNECE region, who authored the Youth Call to Action, and as a proud member of the International Federation of Medical Students Associations. It is imperative that member states do not prioritise management of population dynamics above the rights and well-being of individuals. In particular, comprehensive sexual and reproductive health services must not be sacrificed for demographic goals, especially access to safe abortion and emergency contraception. Sustainable development ensures that the needs of the present are met without compromising the ability of future generations to meet their own needs. As youth activists, this principle is at the very core of everything we strive for. Since sustainable societies thrive on empowered individuals who are able to exercise their rights, we call upon member states to adopt human rights principles throughout all laws, policies and programs, especially population and health-related policies. These policies and programs must contain explicit guarantees to safeguard the sexual and reproductive rights of young people and vulnerable populations, taking measures to eliminate all forms of sexual and reproductive coercion. We are a diverse region with varied demographic profiles. However, there are cross-cutting issues that need to be addressed now in order for young people to reach our potential and in turn become agents for change in our country's societies and economies. Youth unemployment is a critical issue across the region. Therefore, we call upon all member states to recognise that in this challenging economic environment, young people are not a burden, but a source of great potential within our societies. Member states can aid young people to reach this potential by respecting, protecting, and fulfilling our right to education. Quality education and training, including higher education, will allow us to respond to shifts in the global economic environment, access social services, obtain decent employment, and make positive choices regarding our sexualities and well-being. Youth unemployment disproportionately affects the least educated and most disadvantaged. Therefore, we call upon member states to eliminate all barriers to education, particularly those affecting young women and girls, by 1. Ensuring gender equitable norms across society, removing all financial barriers to education, addressing discriminatory practices such as early and forced marriage, recognising and fulfilling the sexual and reproductive rights of young people, including access to information, and ensuring participation of all marginalised groups. In addition, we as young people demand meaningful participation within our societies, for it is youth entrepreneurship and leadership that will truly tackle youth unemployment. We are ready and prepared to take on these responsibilities, but barriers to our participation remain at all levels of society. We call upon member states to create political environments that nurture the vitality of young leaders. Our region is facing huge changes in migration trends. These changes can be both beneficial and detrimental to states and individuals. Young people especially are adversely affected by migration, with young migrants vulnerable to human rights abuses. These challenges require a holistic, cross-border and cross-sectoral solution. Member states need to focus beyond their borders and short-term initiatives and ensure that all migration policies enshrine human rights at their core. All member states within the region must realise the human rights of all young migrants, regardless of migration status. Particular attention must be paid to their right to the highest attainable standard of physical and mental health and their sexual and reproductive rights. Finally, on behalf of the 40 young people of the UNECE region who authored the call to action and the organisations that they represent, I would like to impress on you all in the strongest possible way that we as young people are dedicated to creating the world we want for ourselves and future generations. Whilst we can all appreciate the population-wide benefits of education and health services, we would like to emphasise that these are basic human rights and should not be thought of as a means to an end. Let us be clear, we as young people require our governments to respect, protect and guarantee our human rights, which when we are empowered to claim, allow us to attain the highest levels of education, live healthy lives and make the best possible decisions for our futures. We will continue to hold our states to account for our human rights violations, and we will provide strong youth leadership to all young people across our region. With this, I implore you all to stand with us for the good of our societies.
Thank you very much for this comment, and I would like now pass the floor to the speaker of the Danish Family Planning Association.
Thank you, Ms. Chair. This statement is also made on behalf of the Population and Sustainable Development Alliance. Distinguished delegates, population dynamics, sustainable development, and sexual and reproductive health and rights are intrinsically linked. Population dynamics ultimately reflect individuals' choices and decisions about marriage, childbearing, health, and where they live. Therefore, mitigating and resolving the challenges of today's population trends and dynamics, including urbanization, migration, aging, population growth and decline, alongside addressing unsustainable patterns of consumption and production, can be turned into new horizons of opportunity for achieving sustainable development if individuals and families are able to enjoy expanded rights, freedom, and choices. Access to sexual and reproductive health information, education, and services, including voluntary family planning, and the ability of women and young people to exercise their sexual and reproductive health and rights can help reduce growing population pressures on food, land, water, energy, housing, education, health, and other resources, and offer opportunities for economic prosperity, employment, and poverty eradication. Whether a country is rich or poor, its demographic profile, including its population size and rate of population growth or decline, age structure, and urbanization and migration levels and trends, has significant implications for the social, political, and financial development of the country. For this reason, governments around the world have, over time, sought many different policy solutions to try to influence fertility levels in either upwards or downwards directions. Unfortunately, we have witnessed numerous policy initiatives which led to human rights violations in this connection, from one-child policies to forced sterilization, as well as denied access to safe abortion and contraception. However, from the experience of a low-fertility country such as Denmark, an important lesson can be learnt. Empower individuals to make their own reproductive decisions through the provision of information and access to services. When this is coupled with supportive structures and mechanisms such as government support for daycare and good maternity and paternity leave systems, the population size remains more or less constant, and demographic trends can positively influence growth and prosperity. This is particularly the case when there are also investments in education and empowerment of women and youth. The message is clear. Population dynamics can and must be addressed in ways that respect, protect, and fulfill human rights, including through the advancement of sexual and reproductive health and rights. As a matter of fact, it is this year 40 years since abortion was legalized in Denmark. At this time, it was assumed that legalization of abortion would lead to abortion being used as an alternative to contraception, and thus the abortion numbers were expected to rise dramatically. However, the contrary happened. Providing access to safe abortion, coupled with an increased focus on quality, sexuality, education, and information, has empowered women and men to make better decisions for themselves, and the abortion rate has actually reduced significantly. However, clearly, there is still a challenge which needs to be addressed. A report from 2010 by the Danish Health and Medicines Authority showed that unmet need for appropriate contraceptive information and lack of ability among young people to act on their knowledge is a significant factor contributing to unplanned pregnancy and abortion among women aged 15 to 24. The report shows that despite good progress made over the last 40 years, it's necessary to further strengthen the provision of comprehensive sexuality education and provide young people with more information about contraceptive choices, as well as continuing to ensure access to safe and legal abortion. Moving ahead, post-ICPD plus 20, it's critical to continue the struggle to ensure that women and men in the UNECE region can make good sexual and reproductive health choices on a sufficiently informed basis. It is a win-win situation. Through universal access to sexual and reproductive health and rights, alongside wider investments in health, education, and gender equality, the challenges associated with population dynamics can be addressed and the opportunities harnessed, helping secure a more sustainable future for all. Thank you.
Thank you very much. And the next on my list is a representative from Deutsche Stiftung Weltbevölkerung.
Thank you, Madam Chair. Distinguished delegates, when I read the note by the UNECE Secretariat in preparation for this conference, my attention was drawn to the following paragraph. UNECE countries concerned with low fertility could strengthen rights-based and human-centered policies aimed at removing the health, economic, financial, and social barriers that prevent families and individuals from realizing their fertility choices. The paragraph refers to low fertility countries, but its content is just as applicable to countries with high fertility, where DSW works as a development organization specializing in sexual and reproductive health and rights. As a development organization, DSW is actively engaging in the debates on the post-2015 agenda. We share the opinion that a global agenda for sustainable development is needed, and the paragraph just cited shows the need for global goals also on the topics covered by the Cairo Programme of Action. Such a goal must be firmly based on human rights and individual choices. This is reflected in the high-level panel report on the post-2015 agenda. But it is in stark contrast to the spirit of the Programme of Action that the report of the Sustainable Development Solutions Network to the Secretary General proposes a goal on reducing fertility rates in order to achieve development within planetary boundaries. When speaking about the effects of population on development within planetary boundaries, the UNECE region has a special responsibility for two reasons. Firstly, although climate change has mainly been caused by the production and consumption patterns within our region, it is mostly people living in low and middle income countries that are affected by it. And secondly, most innovations and funding needed for mitigation of and adaptation to climate change will have to come from the UNECE region. As part of the common but differentiated responsibility, a cornerstone of sustainable development, UNECE countries need to support vulnerable people in adapting to climate change and the risks related to it. And this cannot mainly be done through improved education, as the background documents for this conference suggest. There is an urgent need for global governance on these issues, for global goals on emission reductions and climate protection. Also, this has to be part of the post-2015 agenda. And there is a need to support the adaptation to climate change in accordance with the common but differentiated responsibility. There are many ways of adapting to climate change: building dams, improving irrigation system, migration, and many more. But it can also be a form of adaptation when women and couples choose to have fewer children because their situation is worsening due to a phenomenon that is caused by our unsustainable production and consumption patterns. This shows how our behavior influences very intimate decisions of people already affected by climate change. This must not lead to defining fertility reduction as a development goal as proposed by the Sustainable Development Solution Network. Instead, it must lead to ensuring the right to take these very intimate decisions free from coercion. For this, we need to anchor universal access to sexual and reproductive health and rights in a global post-2015 agenda. It's about human rights, it's about realizing fertility choices, and it is part of our common but differentiated responsibility on a path towards sustainable development. Thank you.
thank you very much for stressing topics like climate change and the ecological boundaries of our planet. And I'd like now invite a representative of the Asian Forum of Parliamentarians on Population and Development for his or her comments.
Good afternoon. I'm Ramon San Pascual. I represent the Asian Forum of Parliamentarians on Population and Development. We are a group of parliamentarian organizations in 25 Asia-Pacific countries, which include 5 in Central Asia, and some of the parliamentarians are here, sitting in this meeting. And in September this year, there will be a similar meeting. This is the 6th Asia-Pacific Population Conference that will be held in Bangkok, exactly the way that this UNECE meeting is ongoing now. Now, for Central Asia, we just had a meeting of, on young people, for which an outcome document came out, and it's being distributed in this meeting now. And it's quite strong, and we support, therefore, the position read a while ago of the young people for the entire Europe. But for this particular intervention, as I listened quite intently on the presentations this afternoon, we would like to focus on one thing that maybe Asian leaders and parliamentarians can take and learn from its counterpart in Europe. This is how to handle the whole issue of an aging population. Now, 58% of the world's older persons live in Asia-Pacific, and that the numbers of older persons in the region is estimated to triple from 438 million in 2010 to 1.26 billion by 2050. 1 in 4 people in the region of Asia-Pacific will then be over 60-year-old. And in Northeast Asia, more than 1 in 3 people will be older than 60 years by 2050, making it the most drastic demographic transformation in the world. For Southeast Asia as a whole, the proportion of the population above 65 is likely to more than triple by the middle of the century, from the current 5% to above 50% in 2050. In 2000, the average age in Asia was 29. By 2050, the average age in Southeast Asia is expected to be 40 years. Japan, Singapore, and more recently, Thailand have among the fastest aging populations in the world due to rapidly reduction of fertility rates. And women constitute the majority of the older population and an even greater majority of the oldest old population. Many other women live alone after the death of their spouse, and this is in certain countries in Asia. They are more vulnerable to poverty and social isolation, and face greater risk of physical and psychological abuse as a result of discriminatory norms and practices. And yet again, referring to the lectures this afternoon, from the perspective of policy, it indicates that aging is nothing to be feared about, but rather, as perhaps being shown as well by Korea and Japan, that aging can be a gracious stage of life. Now, but from the perspective of policy, if education and labor participation are 2 pivotal social investment schemes or policies that can effectively thwart adverse impact of aging society, then there may be comparison between the experiences so far in Europe and certain countries in Asia, but comparison as well to the demographic trend that Asia would have to confront in the next 20 or 30 years, an aging region as well. The AFPPD already enumerated its agenda, a very tentative bullet of agenda for the upcoming Asia-Pacific Population Conference, particularly on aging. And among the highlights of these positions taken by the parliamentarians within the Asian Forum of Network, 1, eliminate discrimination based on age to ensure that people of all ages are able to contribute to society. 2, ensure equitable access to essential health and social services for the elderly, as well as a minimum level of income under national social protection schemes. 3, to ensure access to health care, affordability, and geriatric care training. Mainstream aging into all gender policies and taking into account the specific requirements of older women. Develop appropriate technologies and infrastructure to accommodate the needs of older persons and persons with disabilities. Going now to questions, if only we will have time. I would open 2 questions, therefore. 1, is there a comparability of policy approaches between the experiences in Europe now and what is emerging issue in Asia in terms of demographic changes, an aging Asia? If education and health, as being proposed, would be that also the top 2 of these interventions, considering that Asia is a mixed region of both very young population. There is still countries that have high fertility. There are countries that are still marred in tradition and culture and religion. And therefore, given the mixed demographic characteristic of Asia compared to that of Europe, what would be the dominant policy theme that each region can effectively adopt in the next 10 to 20 years to transition to humane population aging? Thank you very much.
Thank you very much, my colleague from EFPPD. And the last but not least on my list of CSOs is the organization New Ways Women for Women's Human Rights.
Thank you, Madam Chair. I'm also speaking on behalf of the ICPD Plus 20 platform of Turkish organizations. Distinguished delegates, distinguished representatives of academia and civil society organizations. Just 2 weeks ago, I was at the UN Sustainable Development Goals meeting on population dynamics and health, working together with many other women's health and SRHR organizations to ensure that the ICPD plan of action will be included in the Sustainable Development Goals agenda. As it was reiterated many times at the meetings in New York, population dynamics are not a goal or a target in and of themselves, but a tool to plan, a very important tool to plan an analysis by age distribution, urbanization, or migration, so that policy responses can be grounded in evidence and can reach those populations which are in most need. As we all know, the International Conference on Population and Development in 1994 in Cairo brought a significant paradigm shift by increasing the understanding that population issues are best addressed through people-centered and rights-based approaches, rather than solely demographic rationales, which traditionally focused on controlling population growth or decline. In 1994, the urgent need for ICPD plan of action based on gender equality and rights was a response to more than 2 decades of aggressive population control policies in which women's and girls' bodies were the abused objects of these policies, and in which they were denied to right over their own bodies, sexuality, and reproductive capacity, thus in which they were denied the right to life, the right to empowerment, and the right to choice. This was the background as women's groups from all around the world mobilized in Cairo, which resulted in a realignment of population goals within a context of human rights, gender equality, and reproductive rights. However, unfortunately, 20 years later, as we are preparing for the ICPD Plus 20 review, we are observing in some countries, as well as also at the global level, some very disturbing trends that fall way behind the wisdom ICPD has brought to us 20 years ago. In some countries of our region, responses to actual or estimated population decline has led to alarming policies that contradict the spirit and gains of ICPD restricting women's and girls' access to sexual and reproductive health services, their right to safe abortion, but most importantly, their right to choice in the name of neoconservative policies endangering their lives and violating their human rights. Instead, as the UNECE report very rightly states, what UNECE countries concerned with decline in population growth urgently need are policies that enable women to combine their educational and career aspirations with their reproductive choices. Policies such as free or subsidized high-quality daycare services for children, disabled, or the elderly, as women are not only responsible for the care of children, but also for the care of elderly and disabled. Policies that ensure that men equally contribute to household division of labor and care work, and invest in girls' education, including comprehensive sexuality education. It is interesting that at the same time we are now witnessing the re-emergence of some disturbing global discourses that focus on fertility rate control, I quote, for developing countries, which remind us of the past aggressive population control policies in which women's bodies and reproductive capacity were objectified in the name of development paradigms of the time, which have all failed, as we now know. So this sounds like a bad déjà vu, both for women and girls, but also for our aspirations for a new paradigm of development for our planet. Thus, we call on member states of the ECE region, a region which enjoys the highest development in the world, to ensure the best contribution to the further implementation of the ICPD Plan of Action throughout the world, in all its aspects and spirit, and also to ensure that the human rights-based aims and principles of the ICPD will be anchored in the new social sustainable development goals framework. Thank you.